Hi everyone, how are you all? Welcome to my YouTube channel Aradhya Homeo Clinic. Today in this video we'll discuss about what is IVF and how IVF procedure is carried out in IVF hospitals. So IVF full form is in vitro fertilization. Here when couples comes to the counseling, a gynec doctor will do a proper counseling regarding the IVF cycle and the procedure. She will explain each and everything in detail. Based on the counseling, the couple decide to go with IVF cycle. First day to visit a hospital is day 2 of her period. On the day 2, there will be a scanning done for the female and some blood test, hormonal blood test, especially the AMH blood test is done. If the AMH of her is 3 to 6 is the normal range, 2 to 3 also, 2 to 3 is, sorry, 3 to 6 is the normal range of AMH. If the AMH is less than 1 or if the AMH is more than 9, then the condition differs. If the AMH is less than 1, then we call it as poor ovarian reserve. If the AMH is more than 9, then we can call it as PCOS, polycystic ovarian syndrome. So in these two conditions, it is difficult to get natural conception. That is why they decide to go with IVF cycle. And in males, the some blood test and this semen analysis is carried out, right? After seeing the reports, they'll decide whether IVF cycle is best choice or some others like OITI will go with one more IUI cycle or OITI or natural conception. They'll decide based on the reports. Okay, and here the same like in IUI cycle, the follicle monitoring is done. But here the increase of size follicle is done by some hormonal injection. Hormonal injection is given in abdomen or in thigh region. The hormonal injections like Foley, Citro and Meno, these are the three injections which is given to the female in the abdominal region or in thigh region. Based on the size of follicle, they decide whether to go with the same dose of injection or to increase some dose. The decision will be taken by your gynec doctor. And along with this hormonal injection, some supplements is also given to the both couples, male and female. Okay. Then what happens once the size grows to some extent, right? Then they'll give a trigger injection. That trigger injection is given in night time. So if for example if the trigger injection is given at 9:30, leaving like if today's trigger injection at 9:30 p.m., then day after tomorrow at 9 a.m. will be pickup of the eggs will be done. This procedure is done in proper OT with all setups, okay, and with proper anesthetic. In anesthetic only, the patient will be lying on bed in a proper position, and then the pickup of the eggs, okay, it is done. And for trigger injection, for pickup of the eggs, there should be a 45 to 48 hours gap should be there. That is why if the example today is the trigger, then day after tomorrow will be the pickup. Today trigger at 9:30, day after tomorrow pickup at 9 a.m. sharp at 9 a.m. So this much gap should be maintained for trigger and pickup. And on that same day of pickup, the husband should give semen sample and it should be fresh. That should be fresh sample given by the male. So what they'll do, they'll take one egg, okay, one sperm, they'll do embryo, okay, the mating is done, embryo is done. Taking one egg and one sperm, they'll do proper embryo. Okay, it depends upon how many eggs will get during pickup. For example, if we get 5 to 6 good eggs and like for nice sperm, then we can get at least 3 to 4 nice quality embryo. There will be a grading of embryo also, A grade embryo, B grade embryo, C grade embryo, or example. Otherwise, we can say first grade embryo, second grade embryo, third grade embryo. Quality of the embryo is based on this thing. If the quality is good, then we categorize it in an first grade embryo. If the quality is little poor, then it goes under third grade embryo. Okay, we preserve that in a proper embryology setup. In a IVF hospital, there is a proper embryology lab is there. That embryo is grown in a culture media for 5 days. Okay, So that 5 days there will be a embryo formation is done, and it is grown in a culture media for 5 days in embryology lab. So if we consider natural pregnancy, the pregnancy will occur in fallopian tube, right? So that fallopian tube, here this procedure is done in artificial. So we call it as test tube baby or IVF baby. Okay. So this is the difference between natural and IVF cycle. So IVF ಏನಾಗುತ್ತೆ ಅಂದರೆ it is grown in proper embryology lab for 5 days. Okay. Then after 5th day there will be a transfer of those embryo to the female uterus is done directly through a syringe. Through a small syringe needle there will be a transfer of embryo is done, right? So this is done exactly after 5 days of growing of the embryo, and here there is no anesthesia is given to the patient. She will be fine in a normal position lying down, but this is also carried out in OT itself. Okay, through a small syringe it is inserted into the uterus, and from then there will be a after 15 to 20 days your gynae doctor, after transfer of embryo, 15 to 20 days gap, your doctor will suggest to go for with UPT test, urine pregnancy test. If it is positive, then the confirmation scan should be done. If it is negative or you get periods, then you should visit your hospital day 2 of your period. So this is how you get pregnant in IVF hospital, IVF procedure. So there will be more of the supplements taken, more of the injections, more of the hormonal injections, and more of the there will be weight gain will be there during this process. Weight gain for females, and mental restless will be there, stress will be there, anxiety will be there, and the money also, the expenses, financial expenses, stress will be there, burden will be there. So it all will trigger at a time. So you need to make sure that to get a proper support from your husband, from your partner, from your family. So if everything is fine, then you have to decide to go with IVF cycle, because IVF procedure is not a simple thing to get, like okay let's go with IVF cycle. It's not like that. It takes some time, like it may take 3 months if everything is fine, 6 months or 1 year if everything is fine, you get success in one cycle itself. But something goes wrong, then it takes 2 cycle, 3 cycle. So there should be a patience between the couples. You need to have good patience, listening patience, and tolerating patience to go with this IVF cycle. Okay, it's a very difficult procedure, but you need to have a good support so that everything will be easier for you. Okay, regarding if I talk about the success rate, 100% is not success rate. From 100% I can say 75 to 80% is the success rate in IVF, and IUI is very less, we can say 2 to 3% in, but here IVF is 75 to 80% success rate is there if the procedure goes smooth. And here some other options is also there. If a couples is not getting pregnant even by 3 cycle, 4 cycle, then your gynae doctor suggests for alternate options. Alternate options, like there are 3 options. First is OD cycle, ED cycle, and DS cycle. What is OD cycle? OD means oocyte donor. What happens in this thing is the sperm is of husband side only, but the eggs will be of different female. They will make embryo of both, and they will insert into the uterus of the female wife. So this procedure is also done legally, and it is legally advised also. But there should be a consent of both couples, then only this procedure can be carried out. Okay, and ED means what? Embryo donor means the both eggs and sperm are of different people or different couple. They'll make embryo and they'll transfer into the wife uterus. So here the donor is the outside donor, both eggs and sperm. So they make embryo and they'll insert into the uterus. So we call this as embryo donor cycle. DS means what? Sperm donor. Here what happens? The eggs will be of females only, but the sperm will be of different person. They'll make embryo and they'll insert into the uterus. So these are the 3 alternative way to get pregnant in IVF cycle only, but the consent of both couples should be there, and it is done in a proper legal way itself. This is how the IVF cycle is carried out if a couple is not getting pregnant in their own with their own eggs and with their own sperm. There are so many alternative ways to get pregnant. Okay, so I hope everything is cleared in this video regarding IVF cycle and what is IVF cycle, how IVF cycle is carried out in hospitals, and if you are not getting pregnant by your own sperm and own eggs, there are other different alternative ways to get pregnant for your donor cycle. So that also I made clear in this video. And one more thing I want to say, convey that if a couple is not ready to get pregnant right now, they can store their embryo or eggs, they can freeze their eggs for some years, like 2 years, 3 years, then they can transfer into the uterus. This option is also available. Okay, so right now you are mentally and physically not ready for taking care of your baby or responsibility, so you can freeze your eggs. The freezing of eggs is also option available in this IVF cycle, right, to get pregnant. So there are so many multiple ways to get pregnant. It's just you need to have proper knowledge and proper support to go with this cycle, and anything else, nothing, right? I hope everything I have cleared. So if you guys like this video, please do like and subscribe to my channel and share this video. It is a very informative videos. The couples who wants to go with IVF cycle, this video helps them very much, because I have cleared each and everything detailedly. So please do share this video to your family and friends, and please do subscribe my channel. Until then, please take care of yourself and family. Thank you. Bye bye.